Welcome to the 2013 Celebration of Caring. Yeah, wow, what an awesome group. I'm Jean Reed, Director of Volunteer Services here. It's, again, my honor and privilege to be with you here again tonight. Celebration of Caring is our special evening each year hosted by our hospital leadership to salute the wealth of support this outstanding institution receives from you, our wonderful corps of volunteers. And I mean it when I say tonight, I think we have gathered the loveliest group of people that you could actually hope to ever meet. I feel that very sincerely, to celebrate the many ways that you all improve the patient and family experience at our hospital and the difference that you all collectively have made in so many lives here. Many milestones of note. Hopefully everybody picked up a program on their way in tonight by the name tag table, but we do have a few out here in the hallway if you haven't already, but many milestones of note are included in that program this evening. Hopefully you also noticed our graduating senior scholarship poster, which is again right outside this room here in the hallway. These students all served over 100 hours with us during their high school years here, and they received scholarships funded by your earnings from Wild Rose Gifts, the fourth floor salon, rooftop cafe, and refreshment carts. And we recognized 17 scholarship recipients this past month at their senior awards banquets and graduation ceremonies. So, and I know we have a few of them here tonight. If you see them, they should be noted on their name tag. Give them congratulations on our behalf. This past year, you've already distributed over $358,000 through the request for funds process to benefit patients and families. And that is an amazing number. It included over $100,000 to purchase more of those popular Staxi wheelchairs about the house, and of course your commitment to support our new children's hospital, $100,000 this year and a $500,000 total commitment over 5 years. So that was why we had the model upstairs. Hopefully you enjoyed seeing that amazing new facility in 3D and could kind of envision what we'll be enjoying in just a few short years. But in addition to those impact gifts, I guess the major funding, the tens, even hundreds of thousands of dollars, I would like to read a few thank you notes for some smaller items, which I think show your impact in yet another light. And these are all from staff. So the first one is Dear Volunteer Services, thank you so much for your funding that provided to SICU to help purchase new furniture for the family waiting room. Our patient and family satisfaction accommodation scores has significantly improved over the last few quarters. We would like to express our gratitude for your continued support from the SNCU nursing leadership. The next one, to the Volunteer Services Group, thank you for your generous funding to be able to provide sympathy cards, camera supplies, and printer supplies for taking pictures of patients' hands with their loved ones. The back of the photos and cards acknowledge your support, and it is felt by not only the patients and their loved ones, but also the healthcare team, and we appreciate all you do. And then finally, Jane Davis writes, we'd like to share how much we appreciate the generous gift from Volunteer Services to purchase a blanket warmer for our patients at the Center for Disabilities and Development. Our patients will truly appreciate the added touch of a warm blanket as we continue to strive for service excellence every day with every patient. We're very fortunate to have such a strong volunteer services department at UIHC. You're able to do amazing things to help support departments with their needs and goals. Offering the service has been a goal for several years at CDD, but it has not been able to come to fruition. Thank you from our staff and from our patients for this wonderful gift. It'll bring many smiles and show how we go the extra inch at CDD. And Jane Davis is the nurse manager there. So the amounts that you funded, just those 3 projects, not even $10,000. And think how many families have been touched by that. How many patients surrounded by that warm blanket, how many sympathy cards sent to those grieving, how many cherished family photos were provided, how many long nights in a family lounge that was made a little bit more comfortable from a nicer chair to spend the night in. And I think, as Jane so clearly stated, what an impact you've made on staff who partner with volunteer services to improve the patient experience in so many ways that they do strive for, but simply couldn't accomplish alone. And that works both ways. Our success would not be possible without the strong, consistent support from our staff, faculty, and administration. And I know many of you have joined us here this evening. In salutation, in behalf of all our volunteers, I thank you for your partnership, for your strong, continued support that allows us to make a difference together for patients, families, and staff alike. So, obviously, speaking of that strong support, it's now my pleasure to introduce to you one of the hosts of this wonderful thank you celebration tonight, our Vice President for Medical Affairs, Dr. Jean Robillard. Jean?
Thank you. Thank you, Jane, and gosh, I'm so pleased to be here tonight and welcome all of you. And it's so remarkable when you look around the room, how many of you are so dedicated to this place, to this institution, but more importantly, what is important is the impact you have on everyone here. By your work, by your dedication, by your expertise in many ways, by the time you're giving to everyone here. And I don't think we will be what we are today without what you are doing. Hearing also just a minute ago, the gift you made for the Children's Hospital, that it will not be just a hole in the next few years. The hole is coming to be filled up. I talked with Ken Case. He told me probably by the summer or by September, we will see the first level of that. But your impact is a lot more than the gift, your monetary gift that you've done. The impact that you have is on the life of patient, and on the life of their family, on our visitors also as well. And you are really the front door to everything we do here. You're setting a culture, you're setting a tone, and you're really an example to all of us about what we need to do and what we need to give to patients and the attention you give to all of them. I was talking with Jean just before. I heard that we have about 1,500 volunteers during the year. This is just remarkable in many respects. Dean Schwinn, which I will introduce in a minute, show me that over the year you're giving about over 115,000 hours to this institution. If every hour was a seat there, we will fill 2 stadiums. That's about what it is. I mean, it gives you just a proportion of what it is. This is enormous what you're doing, and I cannot really thank you enough. And I'm sure if we had opened this event to all the patients, we'll probably have to do it at the stadium tonight. Because the impact you have and also the thanks they want to give to say to you is just enormous, and we hear that many, many times. And now I would like to introduce Dean Deborah Schwinn. Dean Schwinn came here about 6, 7, 8 months ago. I count because I have the impression she's been here forever now. And she has brought here tremendous energy. She is a superb physician, anesthesiologist, superb scientist, and a tremendous leader. But more importantly, she is probably the best dean we ever had. Dean.
Wow, I'll have to get him to say that again. So I am so impressed. I have been at 3 hospital systems in my entire career, Duke, University of Washington, and now Iowa. And I must say, this is the most remarkable volunteer group that I have ever seen. So congratulations to you all. So I want to get you moving a little bit. So I want to play a very a small little game here so that we can see who's done what, okay? So I want everybody to stand up for just a minute. And those of you who are on the outside, come toward the middle. If you have volunteered at least 100 hours, stay standing. Those of you who are spouses, significant others, or haven't volunteered yet, you can move to the edge or sit down. Okay, 200 hours. stay standing 200 hours or more, 500 hours or more. So stay standing if you're 500 hours or more.
You'll get there.
Yeah. 800 hours or more. Okay. 1,000 hours or more. All right. Wow. At this level, I want to go in smaller increments here. 1,200 hours. 1,500 hours total. So
Those
far.
who work overtime, can they stay up?
So, mind you, this is so far, right? Okay. 2,000 hours or more. Look at all the people standing. This is remarkable. 3,000 hours or more. Wow, you folks, 4,000 hours or more. Oh, these are our lifers here, okay? 5,000 hours or more. I'm looking for a woman named Florence out there somewhere. Who's named Florence? Okay, well, we'll tell you why in a minute. 7,000 hours or more. Now, some of you, if you're on the side and you're not 7,000 hours or more, just move slightly aside so we can really celebrate these folks in the middle. 10,000 hours or more. Wow. Wow. So how many people? We have 2 people standing? How many hours do you have, Donna?
7,781.
And you back there? Oh, you're not. Okay. Miriam, how many hours?
12,592.
Wow. Okay. Congratulations. Oh, what? And you? Whoa. Okay. Thank you. Did we miss anybody? Have we missed anybody?
Edith.
Edith. Someone named Edith with more hours?
Maybe not the best.
Okay, not today. All right, thank you all. Let me introduce Ken Cates, the CEO of UIHC.
Thanks, Deb, and I think you can see why we're so delighted that we were able to recruit Dean Schwinn to Iowa. And I'm absolutely delighted to be here and be one of the hosts for tonight's celebration of caring. When Dr. Robillard and I were walking in, we were both actually saying that this is probably far and away our favorite event every year. It is just remarkable to be able to come and celebrate with all of you everything you do for all of our patients, our families, and our staff. You make just a huge difference each and every day. And we're here to celebrate your dedication, your generous gifts of time and talent for everything you do for patients, families, and staff. Now, you heard from Jean and you heard from Dr. Robillard. We benefited in 2012 from over 1,500 volunteers who donated over 115,000 hours of service. I'm a hospital administrator, so we like to do the math. That's worth over $2.5 million of service. So just remarkable. So please give yourselves a hand. Now, from the exercise that Dean Schwinn just did, you probably know all of this, but there are 15 of you in the room or upstairs tonight that have reached 1,000-hour milestones this year. 5 more have reached 5,000 hours, and 1 has reached, Jean, 15,000 hours. So just remarkable. That's 55,000 hours of total service from just 21 volunteers. Many of you will also receive the 2013 Governor's Volunteer Award for your service in a ceremony a week from today. We also want to recognize tonight to those of you who devote countless hours as members of our Volunteer Services Advisory Board, providing important fiduciary stewardship of the funds raised from Wild Rose Gifts, the 4th Floor Salon, Cradle and All, and the Rooftop Cafe and Hospitality Carts, among other responsibilities. You've also heard that the funds generated from those initiatives and others raised over $358,000 to support initiatives here for our patients and for our families and for our staff. Now, while we talk about contributions, they really cannot be measured in such simple terms as just dollars. It's really the individual stories that really highlight the power of what each and every one of you do every day. And so I'd like to read some recent letters we received from patients and families. Dear UIHC volunteers, At 34 weeks, we did not expect to be in Iowa City delivering our identical twin boys, but that is exactly where we were. As I heard them cry for the first time, my husband carried them over to me. The first time I saw my baby boys, they were wearing handmade hats. I will never forget that very moment. What a wonderful feeling and special moment made that much more memorable by your gift. Thank you for sharing your talents with complete strangers you will likely never meet. Another one from a guest of our SNCU, sounds like a candy bar, but that's our surgical neurosurgical intensive care unit family lounge. Thank you for the sympathy basket of snacks given to our mother. The unexpected gesture of kindness can mean so much. Your outstanding volunteer in the waiting room was appreciated by all of us. What a trooper and blessing for our family. From a pediatric patient, dear volunteer, thank you for my sock monkey. I named my new monkey Strawberry. When I was in the hospital, Strawberry helped me be brave and not so scared. Your friend, such and such, age 8. And another one, to the volunteers. On behalf of my daughter, I want to thank you for the many kindnesses that were extended to her and her family during our 5.5-week stay. The Rossi room was simply a godsend, and the workers there were always so helpful and kind. When we learned that Krista would have to spend Christmas in the hospital, it was disheartening, but the angel gift cheered her up considerably, so thank you for that surprise. For all the other kindnesses that I have not mentioned, please know that you touched our hearts in many ways, and we are deeply grateful. Best wishes to all of you with love. Now, I could stand here for hours just sharing that kind of feedback because we receive so much of it each and every day. But I think these snapshots collectively show the caring touch you bring to this institution. And in so many different places, in so many different ways, it's the small gestures of caring that add up to the big difference that we keep referring. And that so ties into our focus on service excellence here at UI Healthcare. And so I've said it every time. I've been a hospital administrator for a long time. I've never seen a volunteer program like we have here at UI Healthcare. We are so lucky, and we don't take it for granted. We greatly appreciate what you do. So please, on behalf of the senior leadership team and the entire team here at UI Healthcare, please accept our heartfelt appreciation for the outstanding and compassionate support you provide to patients, families, visitors each and every day. So thanks very much.
What I love about that last letter that Ken just read when I read that for the first time, so this woman signed this with love. That said as much as almost the rest of the words in that note. So, have you been enjoying your pianist tonight? Where are you, Dan? Dan Knight. I told him B and I shot at the podium so I could. But Dan, if you've looked at in your brochure this evening, we have a little bit of information on him. Dan has talented local artist, just all around great guy. Performed at this celebration longer than I've been involved, 23 years. But again, read your program. But Dan, thank you for. He'll return after the program, so you'll be able to enjoy him for the rest of the evening. Flowers, Pleasant Valley always does a lovely job. Also, thanks to our volunteer services staff, who I think look forward to this event as much, maybe more than you do, to get to see you all together and share our appreciation. And finally, let's show our own appreciation for our food nutrition staff, who have prepared, displayed, and served this beautiful and delicious food and worked so hard to make a special recognition event for us. Let's give them all a hand. So truly, the entire institution appreciates your service here. And on behalf, again, of our hospital volunteers, be sure to pick up your volunteer tumbler memento from the volunteer services staff before you leave tonight. We're pleased to have the opportunity to celebrate your caring and share this time with you this evening. Continue to enjoy the evening together. Thanks.